Welcome to the SIBO Doctor Podcast with Dr. Lela Jacoby, a US-trained naturopathic physician and director of SIBOtest.com, an online breath testing service and education portal for practitioners. In this podcast series, medical experts join us to discuss functional digestive disorders, clinical practice, and research as it relates to small intestinal bacterial overgrowth and associated conditions. This podcast is intended for SIBO treating practitioners and aims to help educate how we may best serve our SIBO patients. If you're a practitioner and want to learn the basics of SIBO, head over to thesibodoctor.com for SIBO education such as the SIBO Fundamentals course, masterclasses, group mentoring, and much more. If you're a patient, please know this information is not intended to diagnose or treat a medical condition. Please ask your doctor before initiating any new treatments. And now, over to Dr. Jacoby and the SIBO Doctor Podcast.
Welcome, SIBO practitioners, to another episode of the SIBO Doctor Podcast. And with me today, I have Dr. Lela Altman. She actually gave a really great presentation on the elemental diet back last year at the SIBO Symposium, but also earlier this year for an association called the Gastroenterology Association of Naturopathic Physicians, and a really detailed presentations with the pros and cons to how to implement an elemental diet for our SIBO patients. She's a naturopathic doctor who practices privately, but also teaches at Bastyr University in Seattle, and she's also an acupuncturist, and really began teaching full-time at Bastyr and started seeing patients in private practice, I think in 2014. And she's also developed a digestive wellness clinic at Bastyr University. And her interests, of course, include gastrointestinal disorders, East Asian medicine, diabetes, and cardiovascular disease, so quite a range. But I really enjoyed her presentation because it gave a lot of great tips on how to really successfully implement an elemental diet. So welcome, Dr. Altman.
Thank you. Thanks for having me.
Great. So how did you get into not just the field of SIBO, but with a special interest perhaps in elemental diets?
Well, it was all somewhat accidental, actually. I, as a student at Bastyr, planned on doing women's health and pediatrics, and had done a lot of additional training in those areas, wanted to go into residency in those areas. And then I had learned about SIBO from one of my clinic supervisors, Dr. Adam Rindy, who gave me a PowerPoint presentation printed out on SIBO. And at that time, I remember thinking, wow, this is so amazing that all of these patients have IBS. I believe IBS is the number 2 diagnosis in primary care practices in the United States, followed by something like back pain. And that at this point, there's no cure for IBS, but if you test patients for SIBO and you can treat SIBO and you can cure SIBO, you can actually get rid of people's IBS. And I thought about how many millions of people that would affect, and I was just always amazed by that. So my first year of residency, I did a presentation for the faculty of Bastyr University saying, look, this is how you diagnose SIBO. Here's how it's treated. You should all screen your IBS patients for SIBO and treat it if indicated. And instead of the faculty doing that on their own, for the most part, they just sent their patients to me to do it. So it sort of accidentally became my specialty, but I'm happy that it did. And so I just started seeing lots of patients for SIBO treatment, SIBO testing that were referred to me by other faculty, and it ended up being my specialty. And then in terms of the elemental diet more specifically, so I myself, years after sort of specializing in SIBO, realized that I myself had SIBO. And so Integrative Therapeutics had come out with the physician's elemental formula, and I said, hey, I'd love to try that product and give you feedback on it. So they gave it to me, and I did it myself for 15 days, and it worked after multiple treatments. Other treatments had not worked. And going through the process of doing the elemental diet myself really brought up for me a lot of the roadblocks that people run into, the complications, the difficulties, not only just with the diet itself, but sort of the emotional aspect of the diet and transitioning off of the diet. And so it sort of put me in a good position to know what my patients would go through and what my patients were going through. And so that's how I began to really focus a little bit more on the elemental diet.
That's great. I think it's always good to have a personal experience for what you actually are prescribing your patients. I do believe that. I often taste things and take things and see how it makes me feel. But that's pretty good to have done it for 2 weeks. And just for the listener, just to kind of orient yourself here, the elemental diet is not a diet treatment for SIBO. It's actually an antimicrobial treatment, a standalone treatment. So it's on par with either conventional antibiotics or herbal antimicrobials. The elemental diet is just as effective, if not more effective, in getting those really high numbers down when everything has failed. I've certainly had experience with that when I've had patients that have failed antimicrobials or antibiotics, use the and especially the integrative therapeutics brand. I've used that one and really successfully. So I really am excited about talking about it today because it is a bit underutilized, I think, and wanted to sort of myth bust here with Dr. Altman. So what exactly are the components of an elemental diet? Can you sort of walk us through that? And what makes it different from something like, medical food replacement like Mediclear or any of those sort of powders that aim to heal the gut?
Yeah, one of the things that makes a elemental diet really different is that the proteins are in the form of amino acids only, which you're not finding in those other formulas, and that there are no other food products generally in an elemental formula. So it is a medical food with pre-digested nutrients, meaning that you don't have to break anything down. With other formulas, there's often fiber or complex carbohydrates or peptides or full proteins that your body would have to break down. So the components of an elemental diet include fats in the form of oil, sometimes medium chain triglycerides or coconut oil, safflower oil, and soybean oil are found in products too. So it could be various different types of oil, the amino acids for the protein component. And then for carbohydrates, again, there's no sort of long chains of carbohydrates. So it's just dextrose or maltodextrin. And then starches may be included, but they should be broken down quickly if they are. And then it also includes essential vitamins and minerals. And again, no fiber.
Mm-hmm. And I think you also mentioned, and us in the SIBO community are aware of the study that used Vivanex, and I think that's how the elemental diet was sort of put on the map in terms of a SIBO, really effective SIBO treatment. There was a study, I think it was in 2004 or something, that showed before and after Vivanex and the effectiveness of that. And we just, us in the alternative community really longed for some other perhaps less synthetic ingredient formula. So, and that was always, at least for myself, a hesitation to prescribe something like Vivanex because it does have some other ingredients that I didn't really like. But so generally, what are the sort of contraindications? So if you know that it's going to be useful, what are the contraindications? When would you not prescribe the elemental diet?
So one of the biggest contraindications for me is a history of disordered eating. I have found that patients have eating disorders by putting them on an elemental diet. So that is a big red flag, and I do always ask about that. Another contraindication potentially would be something like low BMI or patients that are underweight. However, lots of patients actually gain weight when on the elemental diet because they can absorb the nutrients. So again, they don't have to break anything down. Everything's already in a form that can be absorbed. So if somebody is having a lot of gut damage and having difficulty breaking foods down and absorbing them, they can gain weight. So not a total contraindication. You'd also have to be careful in diabetes because of the higher simple carbohydrate and higher sugar content of the elemental diet. If a patient has known fungal overgrowth in their intestines or signs or symptoms of fungal overgrowth. Again, it's not a complete contraindication, but I will be more hesitant to use an elemental diet. And if I do, I'll use it in combination with antifungal medications.
Which is, I think, a good practice because there's so much comorbidity with SIBO and SIFO. I just, in my case, I always use an antifungal when I use the elemental diet just to be on the safe side because I find it so sweet. And the reason really is because people do need carbohydrates without the fiber, so there isn't really a way around that. We do need to put in some sort of dextrose or really rapidly absorbed glucose. So, I do think that's probably the biggest complaint is that it tastes really sweet. And have you found that as well?
I have found that it tastes sweet. And there are things that you can do to help sort of lessen that sweetness, and different formulas have different levels of sweetness depending on if they're more dextrose or more maltodextrin. But that is a big complaint. And with that sweetness, again, comes things like blood sugar dysregulation or tooth pain or brain fog.
Yeah, I think you mentioned in your talk that you had a lot of tooth pain, and that is just a sort of like a real, basically just how much sugar is in there. I'd say, I mean, you get that with candy or lollies, so it just means that there is quite a bit of carbohydrates in there. That shouldn't shy you away from using the elemental diet, however, if you are a practitioner who's contemplating this. Let's talk about what is available out there in terms of how can people get elemental diet and for their patients, or can the patient order it directly?
So there are a few different forms. You had mentioned Vivanex. That's a Nestle product, and that's available pretty widely. You can buy that online. And that is what the study in 2004 that you referenced by Pimentel, Dr. Pimentel and his colleagues used. So we know that that's an effective form. But also, I agree with you that there are some ingredients in that formula that I'm not necessarily a big fan of. So then there's the Integrative Therapeutics Elemental Diet formula, the physician's elemental diet, which is much cleaner and takes out some of those added ingredients that we might not want or that people may be sensitive to. And I am not sure in Australia, Narla, you could probably answer this question, how you would get access to that formula.
So I have, I still have prescription rights in America to some degree, so I can special order that myself. But typically, it's not really that available, and I'm looking into certain avenues of potentially offering that here. In terms of, it's one of the things I have to contact the company, and because it is basically a food product, there are far less TGA issues, which is the Therapeutic Goods Administration. They're very strict here in Australia of what you can actually import and all that. I haven't really found a website where a patient can order it themselves, so I typically special order it for a patient. And the other one is the homemade elemental diet from Dr. Seebecker, and that's available on her site, siboinfo.com, and that's definitely available for patients. They can special order it themselves. They can, all the lists are there of where you get what. In terms of the ingredients right on the website. So there's the amino acid formula powder, and then that's pretty much all you need because you add the oil of your choice to that, and I think she uses honey or just pure dextrose as the sugar. So it's just the free form amino acid formula from, I can't remember the name. You probably know this, Lela, as to
Jomar Labs.
Yeah, that's right.
So yeah, I was going to mention that one as well, because where you are, that would be a really great option. I've done that with lots of patients, the homemade elemental diet. And then the only other thing you'd have to order for that is a multivitamin, which you may already have. Dr. Seebecker, I'm pretty sure, has gone through the hard work of figuring out exactly what micronutrients people need. And so there's a specific multivitamin that she recommends. And off the
Yeah.
top of my head, it's not coming to me, but I'm
And
sure
that's
I'll
all right.
remember
It's
it.
all
So,
there.
sure.
It's like she is
Yeah.
so generous, with her information that she so widely distributes. So, and she's even made videos about the homemade elemental diet. So that is a really good choice. The only caveat to that, and I have not tasted this myself, but that it doesn't taste all that good. And we'll get to troubleshooting in terms of how to enhance flavors in a moment. But that is a common complaint. And I have experience with this because I tried to formulate my own here in Australia, and every batch that I got was like, oh my God, there's no way I can dress this up and expect my patient to drink it. So whatever whatever they did at Integrative Therapeutics with the physician's elemental formula, hats off, because that tastes really good. I tasted that, and it tastes like coconut, and it's goes down fairly smooth compared to the other stuff. But don't let that deter you, because it is a great tool to use when everything else has failed. And I can't emphasize that enough. Okay, so we talked about contraindications. So what are some of the sort of complications that you come across before we get into how to really sort of the nuts and bolts on what it looks like?
Well, people will always have some sort of complication with the elemental diet. And again, as you said, it's not a reason not to use it. It's just important to know how to manage those. So one thing that can come up is we talked about blood sugar dysregulation, other things, weight loss, not being able to tolerate the flavor, nausea, maybe some abdominal pain, constipation, or diarrhea. People may have die-off reactions. So I've sort of figured out for all of these different things that can come up, what can help with that, so that you can help people successfully complete the elemental diet without feeling like they need to stop partway through.
Okay. So talk to us what it actually looks like in terms of what happens for 2 versus 3 weeks for these patients.
Mm-hmm. So just a comment on the 2 versus 3 weeks. So the study that we've referenced a couple of times already, the 2004 study on the elemental diet, found that it was 80% effective after 2 weeks and 85% effective after 3 weeks. And it was not any more effective after 4 weeks than it was after 3. So that's sort of why that duration is what it is. Although for other conditions like Crohn's disease, you'd potentially be using it for longer. So the day in and day out of this is that essentially depends on what formula you're having. It might be a powder, or it might be a liquid. That is all you're having to eat for 2 to 3 weeks. You can have water. Some say you can have some dilute black coffee or black tea. But aside from that, you're only having the elemental formula. And so I recommend people drink, about 6 shakes per day. If you have time in your life to divide that up to 1 every hour and have less each time, that's actually more ideal. But most people just don't really have time to do a shake every hour. And then after 2 weeks, what I do with my patients is I test them with the same day SIBO breath test. And then if they're still positive, then we continue the diet for another week. And if they're not, then we transition off. And the transition off looks like a slow introduction of foods, starting with broths. And I transition patients back onto a low FODMAP diet over the course of about 3 days. And often they're still using some elemental formula just for calories, since they're not getting their full calorie needs through their regular diet.
So the same day retesting, and we'll talk about retesting in a moment, but just for those listening in Australia, you have to give us at SIBO Test a bit of a heads up, and that you want to test your patients, and that patient has to overnight that sample to us, and it can be done, but it just takes a little bit more prep work, or whatever lab you have and utilize. Just make sure you give them the heads up that there is an overnight sample coming, and that needs to be prioritized. What kind of symptoms do you expect on the elemental diet, or what are some common symptoms that are no need for alarm kind of symptoms?
Well, it's not uncommon for people to feel like they're constipated on the elemental diet, and it's hard to know if that's really constipation or if it's just decreased bowel movements because they're not eating fiber and they're absorbing most of what they eat. So bowel movements can really change a lot with an elemental diet, and it doesn't necessarily mean they're abnormal. It's just they're not eating enough food to pass on a regular basis. So you can use whatever treatment you typically tend to use for constipation. I really like magnesium if it does truly seem like constipation, if they're having stools that are difficult to pass, suppositories, enemas. You could probably do other herbal laxatives as well. The next most common complication I probably see is nausea, and that usually starts in the first couple of days and then goes away. And it's likely due to the hyperosmolality of the formula, and it can be improved if you just dilute the formula a little bit more if you're able to do that with the formula you're using. Another thing that can cause increased nausea is if people are taking vitamins and supplements in addition to the formula. I usually have people discontinue any non-essential supplements and non-essential medications because if you don't have a full stomach, sometimes those can be nauseating. And then with Dr. Seebecker's homemade elemental formula, if I'm using that, I will often switch to the lower fat, higher carb option. So she has two options for the homemade formula, the high carb, low fat, and low carb, high fat. And often the high fat causes a little bit more nausea than the lower fat, higher carb version.
Do you see any other bowel changes in terms of, I know that you can see sort of a kaleidoscope of of colors and different stool changes besides constipation. Do you see that very often?
Yep, people will often with the powdered formulas, they'll say, I just passed this like little basically nugget of powder and it was dry and it was gray. And that is not uncommon given what they're eating is essentially just powder and not all of it's getting absorbed. Sometimes people can have diarrhea. I've seen that too. And when that happens, I think about, are they reacting to something in the formula? So some of these formulas may have corn oil or soy oil that a patient may be sensitive to. And so again, you treat for dehydration, make sure that they're staying hydrated and have them drink the formula slowly. And if it doesn't resolve, you just try a different formula and see how that goes.
That's actually something that you really emphasized throughout your talk, to sip the formula very slowly throughout the day. And I think that's probably good advice for also just managing blood sugar and flavor and all the rest of it, and some of these side effects that you've mentioned. Can you give us some tips on if somebody wants to do the elemental diet, the homemade elemental diet, what can you do to improve the flavor of the formula?
There are lots of options for that. So you could add, I'm not a big fan of aspartame, but this is a situation where you might consider aspartame just because it's not going to feed bacteria. But stevia or aspartame to sweeten the formula if you needed to. So the homemade formula is really the one that you would maybe consider sweetening if it's a higher fat version. Some people use flavored magnesium. There's like a flavored magnesium powder that you can add to the formula. I would be very cautious with this. I've had a patient who used one of these formulas, the magnesium powder. She was recommended to do it just to help flavor the elemental diet by her nutritionist. And then she called me having 20 bowel movements a day, and I didn't know what was going on. And it turned out that she was having thousands of milligrams of magnesium per day. So if you use magnesium, just be careful about how much you're using in terms of a flavored product. You could use extracts like almond, peppermint, or orange. It just takes a couple of drops of one of those extracts to really flavor the whole shake. Having it cold really helps, so I recommend people blend it with ice. Using a cup with a lid and a straw so that you're not smelling it can also be helpful. And if you let it sit out, the B vitamins in it, I believe it's the B vitamins, it just tends to make it taste a little bit more funky. So it's better to just not let it sit out for more than the time that you're drinking it. So maybe a half hour or so. And again, if you can't tolerate the product that you're using, you can switch to a different product.
So just to clarify, so the commercial products are already pre-sweetened with a rapidly absorbing sugar, which is, like we mentioned, glucose or dextrose or maltodextrin, usually from a tapioca source, I think you said. And so the only reason you'd need to sweeten it is if you're doing the homemade elemental diet, and you may want more control over how much sweetener you're putting in, perhaps if somebody has, for example, fungal overgrowth. So could you use stevia instead of aspartame, because everybody is sort of cringing when they hear that?
Yeah. Yeah, I've actually never recommended aspartame myself. I've heard other people do it, again, because you don't feed the bacteria. You could do stevia. Stevia is a plant product, so I think there's some very limited risk that you might feed bacteria. I would guess that you're not going to use enough stevia to do that. Stevia is very, very sweet, just a very small amount of it. It's very sweet. And I've also had patients who've used herbal formulas or herbal capsules, even though it's not recommended that you do it. They've done that for one reason or another during the elemental diet, and the elemental diet still worked. So I think small amounts of plant material is still fine.
Mm-hmm. Okay, in terms of, we've talked about retesting. You do it sort of an overnight just to see if there is a benefit of increasing the or lengthening the amount of time that you're doing it with your patient. So, and then, you also mentioned in your talk about this, I found really interesting, and I definitely want to try this out more, is the half elemental diet. Can you talk more about that?
Sure. So a half elemental diet is not really used for SIBO treatment. I've had lots of patients ask, well, can I just do it a couple of days a week or just do a half elemental diet? As long as you're still feeding the bacteria, you're not going to be treating SIBO. But a half elemental diet can be used for lots of other things. So one of the things you could use it for is just providing some bowel rest for somebody who's in an inflammatory bowel disease flare, a Crohn's or colitis flare. It can also be used to increase caloric intake in somebody who's underweight by providing a source of calories for them that's hypoallergenic. And that can be either you're supplementing their regular diet with some elemental formula, or you're doing an elemental formula for just a few days or a week instead of the 2 to 3 week treatment for SIBO.
Yeah, I think the reason why I'd like to try it, not so much for just pure SIBO treatment, but I see a lot of people that are underweight, and they have so many sensitivities. They react to everything. You will be a really good additional calorie booster, but also nutritional booster. So yeah, I'm keen on trying that out.
Sorry to interrupt. I do have a few patients who only can eat 4 or 5 foods, and again are very underweight for that reason. And I've found that to be a really great option for them, because even if you're using one of the other meal replacement formulas, it might have something in that they react to, and you can pretty much guarantee that's not going to be the case with most elemental formulas. Not all of them, but
unless they're sensitive to coconut.
Right.
I've had that happen. I know, I've had that happen. Unfortunate, but it does happen with salicylates and things like that. But anyways, it's just a flavoring, I think, in the physician's elemental diet formula. Okay, any tips for I think you mentioned the side effects would be nausea, weight loss, and just flavoring issues, people not eating all of their servings. But the nausea, you said you basically just dilute the formula, and usually the nausea goes away anyways after a couple of days, I think.
I dilute the formula, and if they're on the homemade formula, then I might switch to the higher carb, lower fat option, just because the bolus of fat can be nauseating in itself.
That makes sense.
Yeah. And then for weight loss, there's lots of reasons that people lose weight. But the biggest reason is just because people are not doing the formula as directed because they don't like the flavor. That's usually why people are losing weight. So the most important thing if somebody's losing weight really is to check for adherence. And I always tell people when I recommend the diet, call me if you are doing less than this amount, whatever it is that I've recommended them that they do, so that I can troubleshoot with them why they're not having the recommended amount. Is it because they're nauseous? Is it because their teeth hurt? Is it because they don't like the flavor? And then I can troubleshoot that with them versus them just not having enough calories.
That makes sense.
The other thing, you can pretty much add however much of the formula as you want. It's not a restricted diet, and that's a big myth that people have about the elemental diet, is that it's restricted and it's basically like a fast. And that's not true. So I provide my patients with as many calories as they require per day just through a formula. And if they're hungry or they're losing weight, then there's no reason that I can't increase the amount of formula that they're having or add some additional coconut or MCT oil to the formula to increase calories.
And you mentioned, well, one of the most frequent questions I get from patients that are interested in starting this program is, can they just do it during the day and then have like just meat for dinner or something? Have you done that? Because I'm sort of, I understand why that would be allowed, or could potentially be allowed, because obviously there's not much there to feed bacteria that we know of. But I have not done that. I've usually just done the straightforward 2 to 3 weeks.
I do not do that. I have a friend who's a microbiologist, and we talked about this, and I asked him about it, and I said, it just doesn't feel like there's nothing in a piece of chicken, let's say, that could feed bacteria. And essentially what he said is, yes, bacteria do grow on protein. And what you might be doing if you're just feeding, or if somebody's just eating meat, is you might be selecting for just that type of bacteria to grow. And you don't really know what that is or what consequence that's going to have by just feeding bacteria that can break down meat or that can feed on meat. And so that's why I don't recommend it. The times that I have recommended it were when patients basically said, I'm quitting this and I'm not going to finish it unless I can eat something. And so if they're going to quit it anyway, and it's that therefore not going to be successful anyway, then I figure, well, you're not going to hurt anything by adding some meat to it. But I don't generally recommend it.
And has it been successful when you did try it?
So I've only done that with 2 people because usually we can get people through the elemental diet with, all the sort of troubleshooting solutions. And for those people, actually both people, their levels went down. But what I typically see on a breath test after somebody completes an elemental diet is all zeros. Like there's just nothing there to register on a breath test. And so their levels went down, but they didn't go down all the way, and they were technically still positive or still borderline positive. And so it's hard to know how much of that was just from the week of the elemental diet that they did successfully already. Like what would their numbers have been like if we just stopped there?
And just to reiterate that the difference between meat protein and the elemental formula protein is that they are in a free form, so they are rapidly absorbed. And with meat, you still have to, it still arrives somewhat, of course, digested, but still it arrives in the colon, whereas the idea with the elemental diet is that there's not much there. And when we see these zeros all the way across, it's sometimes kind of a bit alarming to me, because it's like, oh my God, that poor microbiome in the large intestine. But what we know from sort of extreme dieting and from even low FODMAPs and people being on a restricted diet, it bounces back fairly quickly, which was always the thought of like, why is the elemental diet so successful in treating SIBO in terms of really getting those high numbers down, when we know that in terms of the microbiome, a 2-week, 3-week extreme diet like the elemental diet is not going to do permanent damage. They just go sort of in dormant a little bit, the bacteria in the large intestine, because they do bounce back as soon as you start eating. And which that was always my thought, is like, what, prevents them then from regrowing in the small intestine? And of course, we want to initiate prokinetics, right? I would initiate prokinetics right after the completion of the elemental diet. Is that what you do?
Absolutely. So the elemental diet is, in terms of studies that we know of for treatment of SIBO, is the most effective treatment for SIBO. But to me, that doesn't mean that it keeps recurrence rates down more than with any other treatment. So I'm still using Prokinetics. I'm often doing lower dose antimicrobial herbs after treatment just to keep things at bay and to prevent recurrence, even though it looks like everything's gone. Another thing to note is on a typical breath test, you're not going to see a bacterial peak unless you have more than, I believe, 10 to the fifth microorganisms. And so if there's a 0, it doesn't mean that nothing's there. It just means that maybe it's not registering. And you're absolutely right. If you test somebody a week right immediately after they finish an elemental diet, like that day, the next day, they'll often have 0s. But if you test them a week later, you'll see growth again in the large intestine.
Yeah.
But also, if we consider the stomach acid is killing most of the bacteria that we ingest, and then, the small intestine should remain sterile even after an elemental diet.
Yeah, this goes back to the causative factor of SIBO for that particular patient. Is it a digestive issue? Is it a migrating motor complex issue? Are there underlying conditions that predispose this patient to it? Are there outflow problems? Goes back to our detective work of what actually caused SIBO to begin with. I often talk about that. SIBO is just the consequence of something else going on, and it's our job to find out what that other thing is. And it's sometimes very difficult because they have a lot of overlapping things, a lot of conditions. And when somebody sees me, they have been chronically ill for a long time. And so it's like a noodle salad. You have to, take that apart and take every noodle out and just see what you've got, in a way.
Right.
All right, let's talk about transitioning off the diet. That seems like a really important time and a good opportunity to also check for any kind of reaction.
Yeah, so there's a couple of ways that you can transition somebody off of an elemental diet. One way is just starting to reintroduce foods, and I'll go through that in a little bit more detail in a moment. But another way is to consider using the elemental diet as the elimination phase of an elimination challenge diet. So for those who may not know what an elimination challenge diet is, essentially you eliminate all high allergenic foods from the diet for 2 weeks. And then you add them in slowly, one by one. I usually recommend challenging one food every 3 days so that you give 48 hours to have a potentially delayed hypersensitivity type reaction. And then if somebody tolerates that food, you can add it back in to their diet. And if they don't, then you keep it out. Now, the problem with that is that there have been a few times where I've had patients who reacted to something like rice or oats that was allowed on an elemental or on an elimination phase of an elimination challenge diet. And the benefit of the elemental diet is you have literally eliminated all foods. So there's nothing that's still in your system. So you can begin to challenge any food that might be allergenic at, again, one food every 2 to 3 days, which would take a really long time. You're probably not going to want to challenge everything that they eat, but if there's something that's suspicious, then you'll want to do it that way. And so that would take the time to transition off of an elemental diet and elongate it quite a bit. And you can still use the formula for calories as needed. If you're not doing that, if there's no suspicion of food intolerances, and you just want to start reintroducing foods, I typically start with broths on day 1. Some people with SIBO don't do well with cartilage joints or joint bones because of the glycosaminoglycans. They can be high in histamine. So you can make your own homemade bone broth with just marrow bones or just meats without cartilage. And if they tolerate that broth well, typically they're having that for the first meal or maybe the first 2 meals of the day, then they can add well-cooked, low FODMAP veggies. You can even puree the veggies in the soup if you want to break it down a little bit more. And I have people avoid raw foods. And if you suspect that somebody may have candida overgrowth from an elemental diet, I also have them avoid simple carbohydrates. So that tends to be day 1. On day 2, they can continue the well-cooked low FODMAP veggies and the broth. Again, I would avoid this if you think somebody has yeast overgrowth, but congee could be a good addition on day 1 or day 2, just essentially a rice soup with maybe some chicken in it or some vegetables in it. But on day 2, I would add cooked meats and fish, maybe eggs, and then start adding cooked grains and lightly cooked low FODMAP veggies. And day 3, I transition basically to a simple, clean, low FODMAP diet. And then if all is well, if they do their SIBO breath test, it's negative, then I start challenging low FODMAPs and transitioning them off of the low FODMAP diet, which isn't healthy, in my opinion, long term. Now, other people tend to use the SIBO specific diet or the SED diet, so you can insert whatever diet name you tend to use instead of FODMAPs. I tend to find the most success with the least amount of restrictions with the low FODMAP diet.
Yeah, I often recommend the Biphasic diet that I've created based on Dr. Seebecker's SIBO-specific food guide and the FODMAP, and it's sort of a program. And phase 1 obviously is a great starting point, and it gives recipes and food guides and so forth. So I usually start there, and depending on how people are reacting, transitioning them to phase 2, which is a lot more generous with food portions and food variety. Wow. Okay, this has been so great in terms of really getting into the nitty-gritty of what the elemental diet is. I think we have only a few minutes left for to wrap up. I just wanted to give you an opportunity also to have any other, if you have any other clinical pearls regarding the elemental diet, and then also just where are you? Where can people find you? This podcast is for practitioners, but it's amazing how many patients are listening. So if you want to work with Dr. Altman, we will have all the details in the show notes, but I'll give you an opportunity to talk about that as well.
Great, thanks. So a couple of other things I'd like to mention. One is that, in my opinion, it's not really clear whether we need a truly elemental formula to treat SIBO or whether a different type of formula would be still useful. So a polymeric enteral formula or a semi-elemental formula that may contain peptides but not amino acids might still be effective at treating SIBO. And generally, they're more affordable, more available, and they taste better. So I would be really careful about using one of those and make sure that it has all of the nutrition that your patient needs before you use it. But I think there are other options like semi-elemental formulas that could still work for SIBO because we're not so worried about peptides feeding bacteria. And then the other thing I just want to mention is there are a lot of unattended benefits to the elemental diet. So I think we tend to focus on all of the negative things and what could happen and how do you treat what could happen. But there are a lot of good things that come from elemental diet. So one thing is a lot of people will notice resolution of joint pain when they're on an elemental diet. In fact, there's a study I just read, a pilot study looking at treatment of rheumatoid arthritis with an elemental diet because of this improvement that we see. Also, people will tend to have resolution of skin problems, in my opinion. So eczema, psoriasis, that sort of thing tends to improve. And the cost of the diet is often something people think about. The diet can be very expensive depending on whether you're making your own or you're doing something like Differenc, which is quite expensive. But if you also consider that you're not eating anything for a couple of weeks and you take that cost out of the equation, then it can sort of help augment the cost of the diet. I think that's mostly the high points of what I wanted to hit.
I'm really glad. Well, I'm really happy you actually mentioned the systemic benefits because it makes so much sense. And as naturopathic doctors, we are no strangers to sort of resting the gut diet for systemic inflammation. So it's a really, really good point. For those if it was just rheumatoid arthritis, I probably would go with something, like you said, a bit more affordable. There are other medical food replacements that are specific for gut healing, but these formulas are not elemental formulas, and so I can't endorse them for the use in SIBO. But I'm glad you mentioned that. And it's the other point that I think is really important to address is the cost. So let's talk about that a little. Let's say a 2-week course of the elemental diet at 6 shakes a day would be, if we're talking about the physician's elemental diet, that's like $800 or something, right?
Yeah, that's around, well, if it's 1,800 calories a day, I'd have to do the math again, but I think that's around $650. So it does depend on the caloric needs of the person for sure. They may need more or less calories. And so that would be technically it's 12 scoops a day, which you could do in 12 shakes or 2 scoops per shake in 6 shakes. And I think $650 is the typical cost of that for 2 weeks. If you were doing a homemade version of the elemental formula, I think that would cost about $250 to $300. I believe Vivanex costs about $900, $800 to $900. So it really does vary pretty significantly, and then whether you do it for 2 weeks or 3 weeks as well. But you do really, when I did this diet myself, I found that I had so much extra time. I had like 2 to 3 extra hours a day where I wasn't cooking, grocery shopping, cleaning up after myself, doing dishes, etc. And then I wasn't spending money going to a coffee shop or buying a pastry, going out to lunch, having a drink with a friend. So really that does offset the cost a bit.
Yeah, that's sort of the selling points to my patients. I'm like, okay, it's going to cost a lot, but just imagine how much money you're going to save not doing those things. And also the fact that, the other benefit is people, and I've certainly noticed that with my patients, is the increased energy. There usually is this element of feeling quite a bit better in terms of energy.
That's absolutely true. So people are always afraid that they're going to be hungry all the time and they're going to feel terrible. And it's really not like that, because again, you can have as many shakes as you want. So no need to be hungry. And when you start absorbing nutrients, your energy goes way up. And sometimes I actually have had trouble transitioning people off of an elemental diet because they want to stay on it long term because they feel so good on it. So the people who tend to do the best with the elemental diet are people who are already really restricted in what they can eat and aren't really enjoying eating anyway, can't really go out to eat, have to do all of their own meal prep. For those people, an elemental diet is actually quite nice for them because they don't have to worry about that anymore. And just another point I wanted to make is, again, be really careful about choosing an elemental formula for somebody, because what I've found multiple occasions, I've had patients come in and say this elemental formula is recommended, or I did this elemental formula, sometimes successfully, which is why I'm saying that I think something like a semi-elemental diet might work, where it's peptides instead of just amino acids. But when I look at the formula, it calls itself an elemental diet, and it isn't truly an elemental diet. So in order for it to be truly an elemental diet, it needs to be amino acids only, no peptides, no fibers, no other food ingredients like beet powder or cocoa or vegetable powder or herbs, anything like that. So reading labels is important. And one of the sort of scarier versions of that I have had is a patient who recommended an elemental formula, called itself an elemental formula, and then when I looked at it, it had no fat in it at all. There's no fat, and it had very low calories. So the patient actually did that formula and lost a significant amount of weight and did not feel good on it, and it's because there was no fat in it.
Really good point is to read your labels. And I do want to just tell people about your talk that is actually available on the Gastro A&P website. You can purchase it. It's fairly reasonably priced. It's a really good resource if you're planning to implement the elemental diet into your protocol. And I'll put the links and all of that in the show notes. And the other resource, of course, is SIBOinfo.com, where Dr. Siebecker talks about the homemade elemental diet. So Really want to thank you, Lela, with just talking to me today and sort of myth-busting some of these misconceptions about the elemental diet. So how can people find you if they want to work with you?
So I work at Bastyr University. I see patients. I run a digestive wellness clinic at Bastyr University, which is in Seattle, Washington, and that I have what's called a team care shift, which is part of the naturopathic medical school. So I'm supervising naturopathic medical students seeing patients in the digestive wellness clinic, but I also have a private practice, which is located in the same building. It's also located in the Bastyr Center for Natural Health in Seattle. I do have a website that has links to schedule an appointment, or you could just go through the Bastyr Center for Natural Health website. Either way would work.
Fantastic. And we'll have all those links in the show notes. And also, I always forget to say this, but if you, for those listeners who really enjoy this podcast, you could really help us spread the word by giving us a review on iTunes. And if you don't know how to do that, that'll also be in the show notes. So thank you so much for your time, Dr. Altman, and all the best with your SIBO practice in Seattle. And I'm sure our paths will cross again at one of these symposiums.
Thank you so much for having me. This is great.
Thank you for listening to the SIBO Doctor podcast. We hope you found the information in this episode useful in the treatment of your SIBO patients. Thanks to our sponsors, SIBOtest.com, a breath testing service with easy online ordering, and Quintron, maker of outstanding breath testing equipment. Tune in again for another episode of the SIBO Doctor podcast. Thanks again for listening.